Hello guys, how's everyone? I hope everyone's doing well. So today we're going through hypertension as a summary, and let's start it without wasting time. So the first point I wanted to cover is ACE inhibitors. Now, why are ACE inhibitors important? So ACE inhibitors are drugs that have an extremely important application to community pharmacy or hospital pharmacy or any sort of pharmacy. And the first point I want to talk about is checking renal function measurements. So the Gphc tend to ask about monitoring. So monitoring, they tend to give you a question which will be something along the lines of they'll give you a list of monitoring parameters. So they'll give you like renal function, electrolytes, and they'll say which of the following. So which of the following monitoring parameters is not initiated before starting the drug, right? So you need to wrap your head around and understand that for this drug, you would monitor these parameters before starting. You need to monitor these parameters during initiation, and you need to monitor these parameters afterwards. I need to learn each of these parameters for each drug group that is important, whether it's antipsychotic, whether it's inhibitors, whether it's any other drug group that you know that will be. So let's say that lasts for 1 to 2 weeks after initiation and 1 to 2 weeks after each dose increase, because as you know, Ramepro is dose titrated, right? So this makes sense as these inhibitors can cause hyperkalemia as well as being nephrotoxic in short-term use. Note ACE inhibitors are nephrotoxic in nephroprotective in long-term use, sorry. That's why they're used in diabetes and chronic kidney disease, and ACE inhibitors are mainly renally excreted. And that's why they increase nephrotoxicity when given lithium. That's true. Lithium is nephrotoxic, as you know. ACE inhibitors are also nephrotoxic, and they're both renally excreted. So when you do both in together, you're going to cause increased risk for nephrotoxicity. And this is just one of the evidence point from the last case. Point B is the mnemonic for hyperkalemic drugs. So heparins, ACE inhibitors, NSAIDs, testosterone diuretics, and beta blockers. And the reference range of is 3.5 to 5.3. You don't have to remember that, and we'll give you that. And this is it. And what we need to look is hypomagnesemia, hypokalemia, hypercalcemia, and hypoxia, tissue hypoxia. Things to look out for: the toxin is 0.72 therapeutic range, YBV under the definition of T, and once your range is 1.5 to 3, you're more likely to get doctor state. Next point. Make sure to know the clinic blood pressure ranges, as well as the ambulatory blood pressure monitoring ranges, as well as the home blood pressure monitoring ranges. So stage 1 is 140/90 to 159/99 clinic blood pressure, 160/100 to 180/100 clinic blood pressure, and stage 3 is greater than 180/120 clinic blood pressure. Another topic students tend to pick is target clinic blood pressure, and we'll go through that in another time.